Good afternoon, everyone. It is 2 p.m. and welcome to CCDPH's school health meeting for the month of November. Thank you so much for your partnership and your continued support. We are happy to see you. Hi, Anna. It's always a joy to see you. Thank you for joining. We are going to get started with our meeting. Our agenda today is we'll have a little bit of housekeeping, a few announcements, resources, and events. Our CCDPH Communicable Disease Unit will give us an update, and then we are thrilled to have an update from the Cancer Support Center, and they will talk to us about their school-based resources for the community. Let's get started. Our objectives for our monthly meetings are to keep the school community informed and share valuable resources and offer community support. Please keep your lines muted. If you have any questions, feel free to put them in the chat. And just know that if you missed any or part of the webinar, they'll be posted to CCDPH's website as well as our YouTube page. Couple announcements. The registration for our series for our webinars will be updated very soon on our website. You can scan the top QR code for registration for our December webinar. We are trying to find a platform that best fits this monthly engagement. And so we haven't set a recurring webinar as you guys are normally used to. So for now, we're going to do them on a monthly clip. So you'll find the QR code for December right here, and it's already set up. And then if you scan the bottom QR code, it will register you for our school newsletter, where you will get information outside of our meeting that are related to school-related information, as well as information on registering for our webinars. And all that information will be on our website as well, in addition to registration links and slide decks. Again, here is the registration for our December meeting. And we're also thrilled that we would have the Link and Option Center will be here to discuss their community-based programming, including substance abuse, mental health, and outpatient clinic services in the Southland of the community that they serve. So I'll give people just a second to scan that QR code for the December registration, and then we'll continue on. For those who were able to attend our school health conference last month, October 23rd, we want to thank you for your partnership and thank you for attending. It was a great event. We had about 155 people who were in attendance, including school staff, organizations, vendors, and our presenters. It was well attended, and it won't be the last that you'll see of us. We will have another one next year, so be on the lookout for that information as well. And I just put a couple pictures together so you can see a few of the pictures from our event. And there's also been some pictures shared on CCDPH's social media. This is Dr. Anthony Marinello, if you aren't familiar, who is the executive director of Cook South Intermediate Service Center. He was the lone director presenting as the North and the West had a conflict. So Dr. Marinello was there to take it for the team, and he presented, and we're so happy he was able to attend. Also, two deans from Moraine Valley Community College, which is where we had our conference. They did our morning plenary, and we were so grateful to have both of them. They were fantastic, and we hope to keep that partnership with Moraine Valley. Also, a few pictures in action from our plenary. This is the great Felicia Houston, who did our afternoon plenary. And here we have a couple pictures from our breakout sessions. We had 10 breakout sessions, including sessions from ICAP. West 40 talked about immigration resources. We also had our comfort dogs. Here's a little view from our vendors. You can see it was jam-packed, and we had lots of vendors, and everyone was engaged. We're so grateful. And what's a conference without a movement break? Because you can't just sit still all day long. So our regional health officer, Dolores, is also a certified Zumba instructor, and she got everybody moving and grooving, and everyone had some moves. I'm proud of you guys. You guys had some good moves, so we have to implement that again. And we had some great people there. So I am very excited that we were able to bring it back for the first time since 2019, and we plan on doing it again. So be on the lookout for that. So, um, Hartgrove Hospital has they will be distributing our CEUs for nurses. And I know that some people emailed me and I have not had a chance to respond, and I apologize for that. But please bear with us. We are trying to get all this information into Hartgrove so that they'll be able to distribute those as soon as possible. And we promise that we will take care of that. And I'm not ignoring your emails. I just want to make sure that I have everything together so that I can deliver this to you. And for people who are getting the social work CEUs, they were distributed by West 40, and they had their own QR code at the event. So you should have been able to enter that directly from West 40. So please don't hesitate to reach out if you have any questions or concerns. Oh, and I see that in the chat. There you go. Sorry about that, Denise. Desiree, I'm sorry. Contact information for CCDPH if you have any questions or concerns regarding the webinar, or any general questions if you'd like to report communicable diseases or have any metrics questions, or just would you would just like generally look at our website. Here's some information on those links. A few CCDPH resources. If you'd like to request EpiPens or inhalers, you can do that with the following links that are on the slide. That information is also on our website. And for those who may be opted into the Rescue Illinois, that is separate from CCDPH. So you can contact the Asthma and Allergy Foundation in order to get information on that. If you are requesting Narcan, you can do that from Denise Holman, and her contact information is there. And if you aren't aware, CCDPH restarted our vision and hearing screening September 2024. And right now we are only doing preschool children, but we plan on expanding. So if you have any questions or concerns, or you'd like to get those vision and hearing screenings for your organization, you can contact the email listed below. We have some free flu and COVID vaccination clinics that are coming up countywide. They are separated north and south for your convenience. Insurance is not required, but if you do bring your insurance card, we can bill your insurance. So feel free to check out that information or share for people who may not have insurance and would like to get those vaccinations. As well as I've shared before some of our vaccine partners, because this is the time to start scheduling those summer vaccine events, end of year vaccine events, because we know how hard it is for that exclusion date to get all of that vaccine information in for your families. So this way you can have them come to you and ease the burden a little bit. A few mental health resources. Our behavioral health unit gathered some mental health resources and put them all in one slide, so that you can find this on one resource, as well as some resources for the 988 suicide line, 211 nationwide information resource site, as well as some grief groups for after school for students who may be experiencing loss. And some information for NAMI for teachers, specifically gathered towards teachers, as well as some grief groups and some family support groups that NAMI is having in the northern suburbs. Metropolitan Family Service has a mobile crisis line, as well as the Lincoln Option Center, who will be here next month to talk about their crisis triage living room, as well as some of their other resources and options that they have within the community. If you guys could help me mute whatever line that is, I'd appreciate it. Thank you. As well as some more mental health resources. And Doc Assist is a resource for providers who need some mental health supports for their patients. This may be a resource for the school nurses who are here, so feel free to check that out. There is a pop-up food pantry in Robbins tomorrow. Feel free to share with families or anyone, because we know this is a time when people are stretched thin and they are low in resourced and they are hurting. So we tried our best to find these resources for food pantries. And there are some food pantries in the western suburbs that are coming up, as well as some food pantries that are in the southern suburbs. I'll give people a chance if they need to scan those QR codes. I'll give it just a minute. As well as some resources that we have been sharing for a while, some youth action boards and some information on low-cost tutors. So you can peruse those as you like. Commissioner Cook County Commissioner Tara Stamps is leading an initiative for young women, offering educational, social, financial, and mental health supports. So she's leaning on the beauty shop culture, and she'll be hosting these events for young women inside of beauty salons because for women who attend beauty salons, that's usually that safe place where you can do most of your safe conversations. So she's going to lean on that and expand that and have these events within beauty salons. And at the Cook County Board meeting yesterday, she secured funding to continue and expand this partnership. As well as Cook County Commissioner Donna Miller is sponsoring a turkey giveaway tomorrow. So feel free to share that information. And Illinois Council for Women, chaired by Lieutenant Governor Juliana Stratton, invites all girls in Illinois between the ages of 5th to 12th grade, to apply for Girls Lead. It is a unique job shadowing and mentoring opportunity. Accepted students will shadow a woman leader in state government and see the direct impact women make on Illinois. And the deadline is December 1st. You can apply by scanning this QR code above. There is a nature night going on at the University of Illinois Extension tonight. A little chilly, but if you like that, you can go outside and get a little fresh air. Helps with seasonal affective disorder, which I don't know about you, but it's starting to come on. It's a little dark, as well as some information on how to protect yourself from respiratory viruses that are common during this time of year. Some more food pantries, and I will stop sharing. Well, not stop sharing. I will pass it on to Abby Joseph, who is our communicable disease specialist, and will give the communicable disease update. Are you here, Abby?
Hey, thanks, Kelly.
Hi,
Yeah, I can take it from
no
here.
problem. You could either take control or I'll run your slides, whatever is best for you.
Yeah, if you want to just keep going, that'd be great.
Okay, no problem.
Yeah, so like Kelly mentioned, my name's Avi. I am an epidemiologist with the Cook County Department of Public Health, and I was just going to talk about some respiratory season happenings. Can you go to the next slide? So, first wanted to put in a plug for our respiratory dashboard, and I'll be sure to drop links to all of this stuff in the chat afterwards. Um, our dashboard is a really great source of information. This is the landing page. You can kind of see we have these activity levels for COVID, flu, and RSV, just to kind of give you a general picture of what's going on. Those activity levels are based on emergency department data and based on kind of a CDC algorithm. Also, just wanted to call out this section. Is anything else going around that's new this season? That's based on a little bit more symptom information, things like pneumonia, bronchitis, that kind of thing, and that's something that we're currently tracking internally. But it is new this season. You can go to the next slide. So this first graph I'm showing you is based on emergency department data. This is actually a category called broad respiratory, so it's kind of encompassing not just COVID, flu, and RSV, but kind of anything that's respiratory related that can take you to the emergency room. You can kind of see that you can break it down by age groups since this is a school nurse audience. I isolated the pediatric populations are 0 to 4 and 5 to 17, but there's also ways that you can break it down by race and ethnicity and other subgroups as well. And there's also a comparison between this year and last year. You can go to the next slide. And then we also have a number of outpatient labs in our community that report percent positivity for COVID, flu, and RSV, which kind of gives us a good picture of what's going on, kind of, in terms of outpatient respiratory illness. If you remember last respiratory season, we had a pretty significant RSV spike that occurred towards the end of the year. So here you can kind of see that comparison between last year and this year to date. Next slide. And then we also track respiratory pathogens through wastewater data. Again, flu, RSV, COVID are big three. That's what we're really looking at. I'll get into influenza A a little bit more later. There's a reason I kind of picked that one, but you can kind of see we had that significant peak in January, February of last year, and then the normal lull that we have in the summer, and we're starting to creep back up right about now. Next slide. And then again, this is a pretty similar graph to the first one that I showed you, but this is looking at inpatient admission data rather than emergency department visit. But again, using that broad respiratory category and broken down by age group. I will note that for these graphs, it's not just broad respiratory that you can look at. You can also look at COVID, flu, and RSV, and that's the case for a lot of the graphs that we have on our dashboard. You can go to the next slide. So the ICU data that you're seeing on this slide is that comes to us from our reportable disease data. So in Illinois now, it's really only ICU admissions for COVID, flu, and RSV that are required to be reported to the local health department. So that is another source of surveillance data that we're looking at. Here you can see COVID ICU admissions, looking at stretching back to last season and going into this one. Next slide. And then this is our mortality data. Whenever I look at mortality data, I do like to look at it going back into the pandemic just to kind of see how far we've come. You can see that peak, I believe that was from that Omicron wave towards end of 2021, early 2022, and then really have dropped off in terms of mortality due to respiratory illnesses since then. And I believe last season we actually had more flu deaths than we did COVID. So um, just kind of a reminder of how far we've come, and I know a lot of us have been working in the public health or health related fields throughout the pandemic. So just kind of nice to see how things have calmed down from the craziness of the pandemic. Next slide. And then I wanted to call this out just as a really good example of collaboration between our branch, our communicable disease branch, and school nurses from last year. You may remember there was a pretty substantial outbreak of walking pneumonia in school-aged kids last year, and we kind of originally heard of that thanks to you all. I know our folks who work with schools and outbreaks were kind of hearing anecdotal reports from school nurses about clusters or outbreaks of pneumonia that they were seeing in their classrooms. And then, when we started to look at our data, at emergency department data or outpatient lab data, we were certainly seeing that same thing. This rise in this is the bacteria called Mycoplasma pneumonia that was kind of causing that outbreak. So it kind of allowed us to prepare some data, prepare some reports. And when we started getting media inquiries, we were really prepared and kind of were able to distribute that information to the community and take some real good public health action. So just wanted to thank you all for kind of being our boots on the ground as far as what's going on in pediatric populations, and just continue that relationship going forward. Next slide. So like I mentioned, there's some, kind of new information regarding flu A this season. There is this new subclade of the H3N2 flu type that appears to be going around. Some of our colleagues in other countries, I think UK and Japan in particular, have been publishing data that's indicating that this new subclade may be dominant this season. You can see on that graph on the right that um, in the UK, their flu season has really started early, with this percent positivity kind of shooting up above 10% faster than it has the past few seasons. Um, Kind of the issue is that the virus selection for the flu vaccine usually occurs, 6 to 8 months prior to the start of the season, and there has been some what's called antigenic drift. Basically, the this particular strain has mutated some since that virus selection occurred. Um, there is good news. the UK is kind of preliminarily looking at their vaccine effectiveness data, and it does look like the flu vaccine for this season is still quite effective at preventing hospitalization, particularly in our pediatric age group. So definitely want to keep encouraging flu vaccination in our little ones to keep them protected against what could be a worse flu season this year. You can go to the next slide. And then this is just some kind of more up-to-date data on our on influenza-related ED visits. You can kind of see that the last few weeks in particular, there's definitely been this spike in influenza-related ED visits. This is among 5 to 17-year-olds. So, like I said, definitely want to keep that in mind and encourage vaccination as this flu season could be worse than it was last season. You can go to the next slide. And then just wanted to call out school outbreak reporting. I know you guys have been doing this for a long time. You're probably aware IDPH has guidance on outbreak reporting for specific pathogens or conditions, kind of, when you should be reporting, what constitutes an outbreak, all that good stuff. But if you have questions, always feel free to reach out to us. I have those that contact number and email on there, but I know a lot of you have, existing relationships with folks in our communicable disease branch, whether that's, Michelle, Sheila, Shirley. So definitely continue to leverage those relationships if they're there. But yeah, you can also reach out to this number or this email if you do have an outbreak to report or questions around communicable disease in your school. Next slide. And I think that was it. I will also mention that we have this weekly respiratory report, and if you are interested, you can reach out to Courtney from our branch, and she'll be happy to add you to that listserv. And like I said, I'll be sure to put all of these links and contact information into the chat once I'm done. But happy to take any questions if there are any.
That was very informative, Ivy. We'd appreciate you putting those links in the chat. And if anyone has any questions for Ivy regarding respiratory season, which sounds like it's not going to be fun, so we'd be we'd be happy. That smile cracked me up. We'll be happy to take questions. If not, we want to thank Ivy for taking the time out to enlighten us on what we are to expect this respiratory season. And we look forward to hearing from you in the future. Thank you, Avi.
Yeah, thank you.
Take care. Thank you. I would like to welcome Kelly Friel from the Cancer Support Center. Kelly is going to talk to us about their community offerings and school-based support for people who are survivors or surviving cancer. Kelly, are you here?
I am. My camera is not working, so
No
you'll see my
problem.
voice.
No problem. I'll share your slides,
Thank
advance
you.
your slides. Thanks.
Perfect. As Kelly said, I'm Kelly Friel. I am a licensed clinical practicing counselor and an art therapist at the Cancer Support Center. We are located in the south suburbs in the Homewood and Mokina area, but we can service anyone in the state of Illinois virtually, as well as on site at schools, depending on what your need is. So, a little bit about where we come from first. Kelly, if you could advance the slide. So about the Cancer Support Center opened up about 32 years ago with the idea that we wanted to support more people in the community. We wanted to establish just better support for the entire family impacted by cancer. So utilizing evidence-based programs and services delivered by professional therapists, counselors, nutrition educators, healthcare experts. We wanted it all kind of in one place in our community in the south suburbs to be able to support anyone going through cancer for free. There's enough barriers to care that we wanted to remove those as much as possible. Next slide. So we support survivors, so that's the person with cancer themselves, caregivers, so that's anyone else in the family, bereaved individuals, so anyone who's lost a loved one to cancer, and then children and teens. So any child or teen, say they have a grandparent with cancer, a parent with cancer, a sibling, a friend, or themselves, we're here to support everyone in the family. We have a 5-point model. This is kind of our center in a nutshell. is we have a counseling and stress management pillar where we offer things like free in-person virtual counseling, at school counseling, and art therapy, meditation, guided journaling, guided meditation, sound bath, things like that. Our next pillar is our fitness and physical wellness pillar, where we offer different exercise classes designed for somebody in treatment or beyond treatment. So things like yoga, Zumba, massage therapy, specific fitness consultations. Our next pillar is our nutrition pillar. We have a cancer nutrition education program. So our cancer nutrition educator hosts all sorts of different classes, as well as different nutrition educators in the community to debunk myths and help people really distinguish between good information and bad information. Our next one is our education networking pillar. This is really where our child and family programs fall into, where our CSC at School program that I'm going to talk to you about in a minute falls into, and where our support groups and specific cancer-based groups and networking opportunities fall into. We also have a body image pillar. This is where we have our free wig boutique, so free. Everything we do is free, but that one is especially flashy for people, as well as free breast prosthetics, cosmetic classes, etc. Next. So our CSC at School program, which is what I'm primarily here to talk about today, actually got up and running in about 2019. We had a kind of found a need for students impacted by cancer to have services provided to them on site at their school. We looked at our numbers, looked at our child and family programming, and noticed that there was little to no children utilizing any of our services. But we were being reported that there were so many people in the family that could be utilizing services. And the problem was with, how busy different families are, and especially when there's cancer in the family, there can be barriers like transportation. Kelly, if you can go to the next slide. Never mind, go back. I think I must have had a different version I listened to. So there can be barriers to treatment, such as, or barriers to access to resources such as transportation and finances. We wanted to make sure that we really established a way to meet families where they were at, and provide some consistency. You might be thinking like, hey, I don't have any children or adolescents at my school that are diagnosed with cancer. And that doesn't mean you're not going to run into any. So I have the stats up there for adolescents, but also underneath the age of 15, we're going to have about 9,000 children diagnosed with cancer, and about 1,000 of those are expected to pass away. The mortality rate for children and teens diagnosed with cancer is actually continually decreasing, which is a great thing, but that actually means that we could potentially be running into more children and more teens in our schools who have had a cancer diagnosis at some point in time. Here's the numbers for the adolescents, obviously, age 15 to 19. And the needs for teens and children, they really can differ from their peers quite a bit. Next slide. Many more teens and children will be impacted by a family member with cancer. So when there's cancer in the family, there becomes changes in routine, responsibilities, stress levels, support people. So identified support people is a big one I like to flag. It may be hard for your students to identify who to go to when they're having different issues, different changes in their lives. Maybe mom or dad or grandma or grandpa or whoever in the family has cancer is usually their go-to person. So how can we help them identify who might be that next best person to go to in these different instances? Some of these children and teens may be feeling scared, angry, neglected, lonely, or even embarrassed, especially by feeling a little bit different than their peers. Consequences in these changes include school performance issues, isolation, issues with friends, and behavioral changes. We also might see physical changes. So at the nurse, since a lot of you are nurses, you might see in the office, some kids that are exhibiting headaches, weight loss, fatigue, just some big differences than maybe prior to their family member's diagnosis. And that's kind of a red flag that we need to dig into things some more. Next. So there's just a general increased level of stress in these families. Sorry, I got one more little blurb of information before I go on to that. But one thing I want to note is that there's evidence from the American Brain Association that is noting that chronic stress like that from a cancer diagnosis can cause inefficiencies in their brain as well as brain changes that can lead to decreased spatial and verbal memory abilities altogether. So that's like a major thing, is that they just might not be able to retain information. And I wanted to definitely note that as something to keep in mind. So why are we providing school-based support? With finances, transportation, and unpredictable changes to schedules, we can push counseling and other supportive services kind of to the bottom of the to-do list. And we want to make sure things are as predictable as possible. When we have, especially a child in treatment, their parents don't want to take them to one more thing. They want them to be doing as many normal things as possible. So if we can still get them that support at school, if there's a family member who has like a severe diagnosis or something like that, we want to make sure that we're taking some of the burden off on that. And so that's why all of our programs are offered free to the student and to the school. Next. So here are some of our kind of an overview of our in-school support options that I'll briefly go through. We have art therapy groups offered, individual counseling, virtual support options, workshops for students, workshops for staff, emergency support for staff or students, especially in instances of end-of-life issues or grief services. So say there's a student or a staff member kind of getting to end of life stages and you need some kind of on-site support that's specified to the circumstance. Same with grief services. We are happy to provide that as needed. And we also do have a referral process I'll talk about. Next slide. So our cancer support groups at schools are facilitated by licensed counselors and art therapists. So we have that dual licensure. They're free to the school and to the students. The groups are for any child impacted by cancer. So these are mixed groups that include students with cancer, students with a family member with cancer, or a student that is bereaved from cancer. We find this mixed group offers a larger amount of children in the group, as well as kind of a breadth of different experiences that these children have gone through, where they can still relate to on their similarities, but also on their differences. And so we have found that to be very effective. We've been in school and doing consistent school groups in about 3 schools since, I guess it's not since 2019, but since after schools let us back in after the pandemic. But we have offered some virtual supports during the pandemic as well. These groups are scheduled to meet the needs of the student and the school to cause as little disruption as possible in the schedule. So especially in our grade schools, our younger schools, we're doing things during their free periods, during their special classes, their lunches. And then when we've done groups in high schools, those are more on a rotating basis. So where we might do things more like, say, a 6-week group, they miss a different class each week versus missing all of the same one all the time. And that's worked out pretty well as well. Next slide. We can offer individual support as needed. If you have a child or teen who maybe individual support seems the most appropriate and you don't have the ability to offer that through your social workers or counselors at your school, we do offer that locally in person as well as virtually. So one thing that we were able to do for a student recently was to offer individual support at school during their school day, during their free period, but they're a little bit further out from where our offices are located. And so they were able to have an iPad or a computer set up for them by the school for them to be able to have their counseling session during school hours. We found there was actually a good continuation of care that way. That child was getting the help that they needed and actually helped them do better in school, and in addition to, because of that. Next slide. We have supports for staffs, workshops, and training. So we have some more in-depth kind of webinars in regards to managing cancer in the classroom. And that means managing a child with cancer in the classroom or managing a child who has a family member with cancer in the classroom. Grief or anticipatory grief of a student or a staff member, we can do a workshop or a training on that. Supporting a colleague with cancer and the horrible circumstances where we would need to do something like memorial art therapy. We can offer some different instances where we can come to the school and provide these services so that the students can memorialize their friends or even their teachers, depending on what the circumstance is. Our counseling is also free to staff members impacted by cancer diagnosis, since we're for anyone impacted by cancer. If there is a loss of a colleague or if there's a staff member with a cancer diagnosis, feel free to send them our way. Other supports we have for children through our center. If you're in the south suburbs, just a note, we do have seasonal camps and workshops throughout the year that are more fun, They're all based on the idea of creating some networking opportunities for the kids to be around other kids in similar circumstances without having to be too in depth in talking about their specific experience. So we do summer camps. We oftentimes will do winter camps over spring break time. We usually try to do some field trip outings, as well as throughout the year, we have different groups going. So depending on the needs of the children, we have a tween group going throughout the year that's all art therapy based, where they can come drop in once a month to come make some art. And then we also have specific groups and workshops depending on the kids that we have on our docket. So last year we did a bereavement group where we also had a parent element to that as well to get everybody involved. The kind of one of the last things to note on there is also our volunteer opportunities, especially for teens. One of the best supports that we've found through research and through working with teens is to get them involved in the actual helping part really helps them feel empowered. So providing them with different volunteer opportunities through our center has been really rewarding as well. We do have referral forms. They are getting revamped, so I wasn't able to include one in the slide. We're just kind of updating everything to make sure it's all compliant. So if you would like to receive referral forms in a process, basically if you can get verbal consent or written consent from the parents for us to reach out to them directly, say if they're not going to utilize services through the school, we do have referral forms for that. We have referral forms if you wanted to provide a group or supports at your school. We also have marketing materials that you could include in your school newsletter. Sorry, there's an extra bullet point there. But then also if you want to just be added to our email list to just receive what's going on at the center, to get, receive these opportunities just so you don't forget about them. So say you don't need it right now, you want to be added to our email list, feel free to email me and I can add you onto our list where I send out. I don't send out probably more than like 6 emails a year. So you won't be bombarded. These are where our 2 locations are. We're in Homewood and Mokina, as I said, but we can service anyone in the state of Illinois because of our, different clinical licensures. That's kind of our basis. If anyone wants to walk into our location, say you have some folks from Indiana or something like that, and they want to utilize some of our resources, they're welcome to come to any of our in-person programs. We just can only provide our virtual things to the state of Illinois. Thanks. You can skip my references if you want, but those are some references on some of the things I used. But thank you all for having me. I appreciate your time. If you have any questions, you can feel free to put them in the chat or yell them out too.
Thank you so much, Kelly. That was fantastic. And I know for quite a few people, this is an introduction to the great things that Cancer Support Center can offer within the community. So I hope that it is utilized and shared. I had a friend a couple months ago tell me that her mom was diagnosed with cancer, and I immediately gave her the contact information there. So hopefully her family is using that as well. Again, if there are any questions for Kelly, please feel free to put them in the chat, or her contact information is on the screen if you'd like to contact her at a later time. We appreciate you, Kelly. And Kelly's organization was also at our conference. They had a vendor table and they were very busy. So I know a lot of people got good information from Cancer Support Center. It looks like there are no questions. So we can give you guys back a little bit of time on a Friday afternoon because there are no questions. So again, I just wanted to reiterate, we appreciate everyone taking their time out to attend our conference last month. It was great to see everyone in person and get lots of hugs and put names to faces. You can see people outside of the little boxes. We will be doing it again next year. So be on the lookout for those announcements. And make sure that you register for our December webinar, which will be December 19th, where Lincoln Option Center will be here to discuss their mental health, substance abuse, and outpatient clinic services that they have within the Southland. If there aren't any questions or concerns, and just to reiterate, for those who may have come on late, we are aware that the nursing CEUs have not gone out yet. I'm just asking for a little bit of grace as we are working on that, and we'll be in touch if we need any information and hope to get those fulfilled as soon as possible. If there aren't any more questions, I hope you all have a wonderful Thanksgiving. Watch lots of football, eat lots of good food, enjoy yourselves. Happy Thanksgiving, Anna. It's always good to see you. And I will see you all next month. Be well and have a great weekend. Bye-bye.